Epidemics like Ebola, Marburg, among others, have hit Uganda and neighbouring countries in recent years. These diseases have seen not just the loss of lives, but have also affected business transactions both internally and externally. The attempts to combat these epidemics have traditionally been at the national level, putting neighbouring countries at danger if the disease spreads across the border. Stakeholders are now asking that a cross-border response plan is dropped to avoid the worst that would come as a result of either imported or exported epidemic diseases.
And the best way to manage epidemics is to handle them at source. Source meaning we have to have preparedness, we must have surveillance going on so that whatever information we get, we can use it.
Director Public Health Ministry of Health, Dr. Daniel Chabayinze, acknowledges the need to have one strategy, one planning, monitoring and evaluation, as well as one coordination in dealing with epidemics.
But we also know that if we don't collaborate, we affect people's livelihoods, we affect trade, and we know once we have bigger treaties and agreements where when an outbreak is there, we should not be seen hampering trade. So we've learned from COVID that we need to work as one team.
Chabayinze says unless such is achieved by different countries, then there are chances these epidemics will end up spreading to unaffected countries, yet they could have been prevented.
Because if you may remember, the most recent outbreak which happened in the Kasese region, where we had very few cases, is because we had a collaboration with DRC Congo. We are tracking and using surveillance to know what is happening across the border.
This comes as Uganda Red Cross hosts cross-border collaboration in health and Ebola virus disease preparedness high-level meeting in Kampala. Secretary General, Uganda Red Cross Society Robert Kwesiga, says a lot needs to be done to empower local communities in fighting epidemics and pandemics. Kwesiga underscores the need to captivate local communities in fighting the pandemics, noting that there is already available human resource that is waiting to be used to respond to these outbreaks.
It is a question of having the human resource. We have them. You talk of doctors, you talk of accountants, I can go on and on, we have them. So if our leadership is well organized and taps into this human resource that we have, whom we have trained anyway.
Kwesiga, however, says there are still questions of accountability, as several partners have had to come in directly due to lack of trust of the local accounting systems.
Because you see, all these people, that's where they hide to come in. They hide to come in and say, you know, we are not sure that you are accountable, your systems are not as strong, meeting the international standards. So if we invest, and let them also help us to invest in having robust accounting systems, robust supply chain procurement systems, so we can do it.
The two-day meeting seeks to develop a collective roadmap for cross-border collaboration on epidemic preparedness, develop a national society health technical working group to lead on cross-border collaboration during epidemics, among others. Ramson, Church of Uganda Family TV, News at 8.